Good evening, everyone. Welcome to the Knowledge series on women's health. Today, we have two experts who will talk about various issues which a woman faces. Let me welcome those two experts. We have Dr. Prashant. Good evening, Dr. Prashant.
Good evening, ma'am.
And we have Dr. Seema Pandey. Good evening, ma'am.
Good evening.
So these two people are experts in their own fields. So let me introduce Dr. Seema Pandey first. Dr. Seema Pandey is the founder of Vanshati Fertility, brings her expertise and dedication to fulfill her your parenthood dreams. She is a reproductive medicine specialist with a super specialty in gynecology and deals with infertility. Dr. Seema has experience of 27 years in this field and believes in humane and holistic approaches to treatment. Good evening again, Dr. Seema.
Good evening. Thank you for your kind introduction, Dr. Aparna.
Most welcome, ma'am. I know you are unwell today. Thank you so much for giving time. So we have Dr. Prasant Chandra, who's from Pune. He's assistant professor in Department of Surgical Oncology at Dr. D.Y. Patil Medical College Pune. He completed his DNB in general surgery and in surgical oncology. Then, following his passion for academics and research, he joined Dr. D.Y. Patil Vidyapeeth as a teaching faculty. He is actively involved in teaching of super specialty and specialty students. He is also the principal investigator and co-investigator of several cancer-related research projects. He has written a concise textbook of surgical oncology, which is a single solution for oncology as well as other oncology branch students. So, welcome, experts over here. So today we will talk
Thank you, ma'am.
about. So there'll be question like say, giving to Seema ma'am also and to Prashant Chandra various questions. There can be some common things as well. So my first question, which I want to ask from Dr. Seema Pandey, like काफी कुछ there are so many common gynecological issues that a women should be aware of, and how can they prevent it and manage, because हमें बहुत सारी चीजें we really don't know. Every time कुछ होता है तो we just go to Google and start searching it, but that is not the right approach. So किस तरह से क्या
Sorry,
common
I
issues
was
होते हैं?
disconnected. I was disconnected for a minute. I'm sorry if I missed something.
Hello.
Hello, can you
Yeah,
hear me?
yeah. I'll repeat the question again.
Hello.
Dr. Seema,
Are you
can you hear
asking me
me?
something? Yes, I can hear you now. I was disconnected for a
Hello,
minute. Yes, I can.
Dr.
Hello.
Seema, can you hear me?
Yes, I can hear you. I can hear you. Hello.
Dr. Prashant, are you there?
Yeah, ma'am, I'm there.
Yeah, so let me ask you first question.
Yes, ma'am.
What are the signs and symptoms that women should be aware of that may indicate a potential cancer diagnosis? Because a lot of times, it happens and we don't understand. And when the situation is got out of our hands, then we understand, okay, this is this dreaded disease. So can you just explain what are the signs and symptoms?
Yeah, ma'am, actually, I just want to tell all the listeners that remember one thing: cancer is a painless thing, is a painless entity in beginning. So never wait for pain or wait
क्या
for
कह
some
रहा है वो
serious
क्यों
symptom to
कट
occur. So basically, if you're looking for signs and symptoms of cancer, especially for women, just palpate your breast, examine your breast for any lumps, look for any intermenstrual bleeding. Apart from that, these are gynecological malignancies, but apart from that, look for any dysphagia, look for any ulcerations in your mouth which is not healing, painless.
Okay.
Then look for any unexplained abdominal distension, which is just going on increasing. Consult your doctor. I'm not saying consult a cancer specialist, but consult your doctor. If even consulting your doctor and taking some mild treatment is not helping, then keep a low threshold for suspicion for cancer, because cancer, if detected early, is actually curable, but in late stages nothing can be helped.
Yeah, very true, very true. So we need to be vigilant all the time, keep ourselves checked,
Yes,
basically.
ma'am.
This is what I want
Examine.
to say.
Just look for the subtle signs like getting some intermenstrual bleeding, dysphagia, ulcerations which are not healing, oral ulcerations. Because in Maharashtra, tobacco is very common again among women. So that is one of the thing we see a lot of oral cancers in women.
Mm-hmm. I think it's not only Maharashtra, everywhere, you can see people, women especially chewing tobacco and all.
Taking
So it
tobacco.
is very
Yeah.
common. Yeah, yeah, yeah. So, Dr.
And
Seema,
another
I
thing is
think,
cigarette.
yeah,
Yes, cigarette is
cigarette,
another
yes.
form of tobacco.
Mm-hmm. Correct, correct. So, Dr. Seema, you are okay with the network is fine?
Yes, yes, can you hear me?
Okay, yeah. So, for you, this question, what are some common gynecological issues that women should be aware of, and how can they be prevented or managed?
So, gynecological issues, if we talk about starting from the adolescent, the moment a girl starts having her period, from where starts her gynecological age. We talk in terms of gynecological age. The meaning of gynecological age is this her age from starting of the period. From here, if she takes care of her menstrual hygiene properly, she will not be getting any kind of infection, especially chlamydial infection, fungal infection, or any other infection which can later on ascend to her pelvic cavity, her uterus, and give rise to pelvic inflammatory disease. At the same time, this is the age when this girl is immature, her periods are irregular because her brain and her body is not as mature and fully developed as it should be. So this girl can be having a lot of irregularities in her periods. That could be at the same time would be due to some kind of diseases which later on can prove difficult to treat. For example, polycystic ovarian syndrome or disease. This is a condition every third or fourth girl in our country, rather globe,
Yeah.
is suffering from, and it is taking lot of toll, financial, emotional, and not to mention gynecological toll on these people. Fine. So that is one disease. If this girl knows about her period, she can manage it. If it is diagnosed on time, she can take care of her menstrual history and everything. She can properly know. She can understand her disease, so complications can be prevented. Painful menstrual period is not normal. That is our campaign nowadays, because endometriosis is such a condition. Sorry if I am not able to speak very fluently. I am not feeling well. So,
No, ma'am, it's
endometriosis
okay.
is also a condition. You have to diagnose these girls as soon as possible, but sadly it takes around 6 to 7 years, and that can also be diagnosed at this age. Certain kind of tumors, they also give rise to infrequent or irregular menses at the age of adolescence, and that could be mistaken for the normal physiological menstrual irregularity. That should be known. Once this lady is in her full adulthood, their menstrual irregularities are mostly due to hormonal imbalances, mainly polycystic ovarian disease, hypothyroidism, and um, DUB, dysfunctional uterine bleeding or abnormal uterine bleeding, we call it. Apart from that, fibroid, other tumors, ovarian cysts, these are the things which she can be having. That is very common nowadays, but they are not always symptomatic. They don't give rise to cancer all the time, but these are the conditions. Once she approaches her menopause and perimenopausal area, the same things. Her periods are becoming scanty now. This is the time for certain cancers, certain other hormonal imbalances to be increased in her body. So all these situations she should be made aware of from time to time through an awareness show like yours. That is really commendable.
So thank you, ma'am. So that means I guess the importance of regular screenings and checkup is really important for women in that case, because like in case of cancer also, like doctor just mentioned, that we need to go to regular screenings and checkups just to avoid all these things.
Very true.
Also, ma'am,
So,
another thing, yeah, there are also some misconception and myths around women's health, because up you are meeting regular on a regular basis women from various parts, from various sectors as well, from various class. So किस तरह से like you must be coming across various misconception myths होती हैं women health के around. तो क्या क्या होते हैं and how do you address them?
अब myths regarding the diseases, gynecological diseases, if you are asking, or in
Yeah, yeah,
general,
yeah. No, no,
women
no.
in
Related to gynecological only.
gynecological related myths,
या
fact.
मिसकंसेप्शन या कोई मिसकंसेप्शन.
Misconception, like one misconception I remember, if you are breastfeeding, you can lose your nutrition of the body, you can lose your body shape, your breast can be sagging. All these are totally misconceptions. So once you stop breastfeeding, your body goes back to the normal shape if you are taking proper diet and doing proper exercises. It does not happen. Childbearing is bad for your body. That used to be a misconception in 70s, 80s, up to 90s. All the celebrities, they used to think that if they reproduce, their gynecological organs will loosen, and that will be not remain as attractive, as good as they are in nully Paris situation. But it's not like that.
Okay.
Yeah. And
So
regarding
like,
women, they
yeah. Yes,
and
ma'am.
women, if somebody is using tight breast support or wearing bras, they can have breast cancer, especially during breastfeeding.
Yeah.
These are few things which are coming to my mind. If you have anything particular in your mind, you can ask me.
I have, it was very, though it's not a silly thing, which, but yes, I've been, when I was in a teenager, when I was into like having periods and all, so I used to always घर पे सब होता था कि don't touch this, अचार मत छुओ खराब हो जाएगा. So मुझे तो लगता है ये भी एक मिसकंसेप्शन, एक मिथ है लोगों में जो अभी भी है कि क्यों ऐसा हमारे छूने से अचार कैसे खराब हो जाएगा. So ऐसी कई सारी चीजें होती हैं जो मतलब बहुत घरों में भी अभी भी लोग उनको यूज कर रहे हैं घर में. जबकि आजकल जो मॉडर्न जनरेशन है, जो जेंजी है, अगर आप उनको बोलोगे वो कहेंगे या व्हाट रबिश, व्हाट आर यू टॉकिंग अबाउट,
So,
हाउ इट कैन
so,
हैपन. सो
so
ये
I
चीज.
Yeah, I'll tell you both the negative and positive flip side of this situation. First thing, if you take it positively, menstruation was a period when चाहते थे लोग कि इस महिला को जो पूरे महीने काम कर रही है 3-4 दिन के लिए रेस्ट दे दिया जाए. किसी को क्रैम्प्स होते थे, किसी को ब्लीडिंग ज़्यादा होती थी, हर चीज़ का ट्रीटमेंट नहीं था आपके पास. तो उसको हम हमेशा हर चीज़ों को किसी देवता से, किसी रिचुअल से जोड़ के पहले के ज़माने में देखते थे, टू मेक इट कॉमन प्रैक्टिस, डे टू डे प्रैक्टिस, कि लोग करने लग जाए. तो मुझे लगता है कि मेंस्ट्रुएशन में चीज़ें ना छूना, खाना ना पकाना, घर के बाहर ना निकलना, ये शुरू हुआ था इस चीज़ से कि इस महिला को उस 3-4 दिन के लिए रेस्ट मिले. फर्स्ट.
या.
सेकंड, वो साइंटिफिक ज़माना नहीं था, तो लोग हर चीज़ जो वो जिसकी एक्सप्लेनेशन उनके पास नहीं होती थी, उसको वो ईविल या बैड समझते थे, बैड ओमन समझते थे. तो उनको
या.
ये भी लग सकता था कि ये पर्टिकुलर महीने के इन 3-4 दिनों पे औरत के ऊपर कोई भूत प्रेत कुछ भी आ जाता होगा, तो इसको दूर रखो, इससे मत टच करो, ये करो. दीज आर टू सिचुएशंस. इफ वी imagine the lives of hunter gatherers. These are the two explanation we can come up with. And secondly, as I was discussing with you, कि अब नहा नहीं रहे हैं, कपड़े की जगह कोई राख ले रहा है, कोई कुछ ले रहा है, प्रॉपर सैनिटेशन नहीं है. मतलब मैंने बचपन में कितना सुना था कि आपको एमसी के टाइम नहाना नहीं चाहिए, उससे आपकी हड्डी कमजोर हो जाती है. इमेजिन. तो आपकी बॉडी पे कितनी गंदगी होगी, तो शायद अचार छूने से फंगस लग जाता हो. आई डोंट नो, बट स्टिल आई कैन नॉट गिव फुल एक्सप्लेनेशन फॉर दैट.
There is no explanation to this. Anyways, ma'am, जैसे आपका you have this fertility center here. So, what are the common reasons why couples consider undergoing IVF?
So I'll
Because we
tell
have
you
seen
two
आजकल
things.
काफी IVF clinics खुल रही है जगह जगह in various cities. So, what are the common why couples consider they're going into for IVF?
So, according to me, that was my tagline. If you have read my bio, that 80% of diseases we are suffering from, including self fertility, is because of the faulty lifestyle choices we are making. Be it our career choices, be it our food choices, our 24 into 7 lifestyle choices. Look at us, we have become so career oriented. We are not getting married on time, we are not planning our family on time. And once we are done everything, our age becomes 34, 35, 32 plus, and Indian subcontinent females, their reproductive potential, it is declining faster than our Western counterparts. So उनकी जो 35 साल में 80% से ऊपर घटती है, हमारी वो 30 के आसपास 32 के आसपास हो जाती है. उसके बाद वो टाइम तो हमने पढ़ने में, करियर बनाने, बाकी चीज़ों में लगा दिया. अब अचानक हमने बच्चे के लिए प्लान करना सोचा, 3 महीने में हमको बच्चा नहीं हुआ, तो हमारे पास पेशेंस तो रही नहीं गई है. हर चीज़ हमारे को आजकल स्विगी और जोमेटो पे फिंगर टिप पे है. तो बच्चा भी 3 महीने में नहीं हुआ, उनको लगता है बाय गॉड बहुत टाइम से ट्राई कर रहे हैं, कुछ नहीं हो रहा है, चलो आईवीएफ करा लेते हैं. दैट इज वन साइड. Second side, majority of people who are opting for IVF is because of either polycystic ovarian disease, जहाँ पे अंडे बहुत ज़्यादा हैं, प्रेगनेंसी नहीं हो रही है, या poor ovarian reserve. So, geographically, genetically, we are meant to marry early, complete our family, then take our career as a second inning or freeze our eggs. That these are the two choices for us, the women, as our biological clock is always at conflict with our career clock.
Okay, okay. So in that case, these couples who are going for IVF, they must be going through a lot of emotional challenges as well. Are they or are they not? I think they must be going through some emotional challenges.
Very, very challenging it is. First of all, not pain of not having a child. Our society's tagline, icebreaker sentences, शादी हुई, नहीं हुई तो कब होगी, बच्चा है तो कितने हैं, नहीं है तो क्यों है. Those questions for those fertile couples who are suffering, trying and not able to achieve it, that is like something very bad. They are experiencing it, taking it very badly. And उनको लगता है कोई उनको कांटा चुभा रहा है, टॉन्ट कर रहा है उनके ऊपर. And every day, every function, wherever there is a gathering, the same question is being asked. On top of that, they have performance pressure. They have to select the days, they have to go to the doctor, they have to meet the expenses. In our country, infertility treatment is not covered under insurances. Most of the टू
Acha.
और थ्री कंपनीज नाउ. यस, बिकॉज हम
Okay.
दुनिया के सबसे पॉपुलेटेड कंट्री हैं, हमारे यहाँ पॉपुलेशन कंट्रोल पे पैसा खर्च होता है, इनफर्टिलिटी पे नहीं. जबकि हकीकत ये है कि आज के दिन में अब हम भी नेगेटिव पॉपुलेशन के स्टेट में जाने वाले हैं. इंडिया भी अब मिडिल एज में आ रहा है, बूढ़ा होने वाला है. तो इनफर्टिलिटी पे जितना खर्च आता है वो कपल को अपनी जेब से भरना होता है, उसका प्रेशर, सोसाइटी का प्रेशर, एक दूसरे पे, हस्बैंड वाइफ पे, हस्बैंड टाइम से ना खाली हो, डॉक्टर पे ना लेके चला जाए, डॉक्टर ने जब साथ रहने को कहा उस वक्त उसकी ड्यूटी कॉल आ जाए, ये सारी चीज़ें मिला के इस कपल की जर्नी इमोशनली बहुत ही टर्मोइल्ड होती है। बहुत ज़्यादा इनको हैंड होल्डिंग की ज़रूरत होती है, मेंटल एंड इमोशनल सपोर्ट की ज़रूरत होती है अपार्ट फ्रॉम द मेडिकेशन।
Mm-hmm. Oh God, this is so scary. So, ma'am, जैसे like if you talk about the hormonal changes which happens in our body, like जब puberty होती है, menstruation होता है, then pregnancy comes, and उसके बाद हमारा menopause आ जाता है. So all this actually affect ourselves very badly. तो हमारे body में बहुत hormonal changes होते हैं. तो इसको कैसे इसको हमें कॉम्बैट करना चाहिए, बिकॉज काफी डेवलप चीजें हो जाती है जो कभी कभी अलग अलग सिम्टम्स, बॉडी में सबके अलग अलग सिम्टम्स होते हैं, किसी कुछ किसी की कोई प्रॉब्लम आती है, एंड एवरीबडी सफरिंग फ्रॉम ऑल दीज चेंजेस. सो कैसे, व्हाट इज द रेमेडी ऑफ इट? आर देयर एनी सप्लीमेंट्स, कैसे हमें लेना चाहिए मेनोपॉज के टाइम, या क्या, हाउ हाउ डू वी
तो
हैंडल दीज हार्मोनल चेंजेस?
तो मेनोपॉज के लिए मैं बोलती हूँ कि एक चुटकी एस्ट्रोजन की कीमत तुम क्या जानो रमेश बाबू। तो वो जो ईस्ट्रोजन नाम का हार्मोन है ना, वो एक औरत को बहुत सारी चीज़ों से प्रोटेक्ट करके रखता है। औरत का
ओके.
सारा औरतपन उसकी वजह से होता है। जो वो विड्रॉ होता है, लोग कहते हैं ना कि औरतों को हार्ट अटैक नहीं होता, कम होता है। आपने सुना होगा, तो ज़्यादा सिवियर हार्ट अटैक एंड चीज़ें पुरुषों को जल्दी होती हैं, यंग
जी
एज में
जी.
होती
या.
हैं, ज़्यादा होती हैं। महिलाओं को हम उतना नहीं सुनते हैं। उसके पीछे रीज़न है कि जब तक हम ईस्ट्रोजन से कवर्ड होते हैं, हमारी बॉडी, जब तक हमको पीरियड आती है, हम इन बीमारियों से मेन के कंपैरिजन में प्रोटेक्टेड होते हैं ज़्यादा। Once that protection is gone, we are exposed, in fact, more exposed for these things than
ओके.
men. Fine. तो ये जो मेनोपॉज है, पहली चीज कि ये ग्रेजुअल प्रोसेस है, सडनली बंद नहीं होती। हम इसको पेरीमेनोपॉजल पीरियड कहते हैं, 1 से 3 साल में। उसमें हमारी बॉडी में बहुत सारे हार्मोन्स, ईस्ट्रोजन, प्रोजेस्टेरॉन, टेस्टोस्टेरोन, ये सब कुछ धीरे धीरे खत्म होते हैं। एक तरीका है इनका सप्लीमेंट लेना, हार्मोनल रिप्लेसमेंट थेरेपी। पीरियड जाने के 6 महीने पहले से शुरू होती है, वो एक्सपर्ट हैंड्स में कराई जाती है। या
ओके.
और उसके साथ आपको बॉडी की फिटनेस, वेट कंट्रोल, योर डाइट, एक्सरसाइज, दीज आर मेन थिंग्स यू हैव टू रिलाई ऑन। कैल्शियम और विटामिन डी, मैग्नीशियम, ये सारी चीज़ों के आपको सप्लीमेंट्स की ज़रूरत पड़ती है, क्योंकि बॉडी में कैल्शियम कम होने लगता है एस्ट्रोजन की सपोर्ट जाते ही। तो ये सारी चीज़ों को खाने के अलावा आपको जितने फाइटो एस्ट्रोजन है, जैसे सोय है, गोवी फैमिली की सब्जियां हैं, बीन्स हैं, इसमें एक आइसोफ्लेवोनॉइड होता है जो बॉडी में एक आउटसाइड का फाइटो एस्ट्रोजन, प्लांट बेस्ड एस्ट्रोजन भेजता है। थोड़ा थोड़ा उससे कवर होता है, बहुत ज़्यादा नहीं। जैसे कुछ लोगों को हॉट फ्लैशेस होने लगते हैं, बहुत गर्मी आने लगती है, किसी को जोड़ों में दर्द होने लगता है। तो बेसिकली स्ट्रेंथ एक्सरसाइजेज, रेजिस्टेंस एक्सरसाइजेज आपको शुरू करना चाहिए। फिटनेस आपका मंत्र होना चाहिए। कैल्शियम, विटामिन डी, कैल्शियम ना भी लें, विटामिन डी सप्लीमेंटेशन बहुत ज़रूरी होता है लेने के लिए।
ओके.
ये सारी चीज़ें हम करते हैं, अपनी रूटीन पे ध्यान देते हैं, और ज़रूरत पड़ने पे डॉक्टर से मिल के समय से हार्मोनल रिप्लेसमेंट थेरेपी लेते हैं, जिसके बारे में बहुत सारे मिथ थे कि इससे कैंसर होता है, ये होता है, वो होता है। लेकिन अगर वो सही टाइम से लिया जाए, सही डॉक्टर के उसमें लिया जाए, तो ऐसा बिल्कुल भी नहीं है।
तो मैम, जैसे ये जो आपने बोला कि 6 मंथ्स में करना चाहिए, अगर किसी ने पहले नहीं किया और मेनोपॉज के बाद 1 साल 2 साल हो गए, तब भी वो
ले
हार्मोन
सकते हैं, बिल्कुल
ले सकते हैं
बिल्कुल
उसको?
बिल्कुल बिल्कुल बिल्कुल
Okay,
बिल्कुल।
okay, okay. So, Dr. Pradhan, now linking to this hormonal changes, the question which I want to ask from you, like how hormones can influence the development and progression of certain types of cancer in women? Does it
Well,
happen?
frankly speaking, breast cancer and uterine cancer are totally and totally due to estrogen. I mean,
Okay,
those who are taking hormone replacement after menopause, they have a very
right.
high risk of breast cancer. And if they are taking this hormone replacement only with estrogen without progesterone, they have very high risk of uterine cancer or endometrial cancer. Yeah, I mean, it's not 100%, but it's very high risk. Because I mean, it's how we in cancer we speak that, female body, it's designed in such a way that after 50 or after 55 the estrogen has to come down. If it is not going down, you are prone to cancers, especially breast cancer and uterine cancer, specifically endometrial cancer.
Dr. Seema, do you agree with this?
So actually, he's right that it should be taken alone, and as I told you, it should be taken into under strict supervision. There are
Right.
certain increased chances of getting these cancers, but the study which has proven this, that was done on very old female around 63 years of age. That was the biggest study
Okay.
which has concluded this. Time has
Okay.
changed, the kind of formulations have changed. You don't have to take them orally, you can take them in minimal amount on your skin, and as I told you, when and wherever needed, under proper screening and everything. And chances are for other protections, there is definitely certain risk of getting these estrogen dependent cancers, but रिस्क तो सड़क चलने पे भी होता है.
हाँ, वो तो है,
रिस्क बेनिफिट
एब्सोल्युटली.
रेशियो को आपको देखना है, किस तरह से आप ले रहे हैं, कौन ले रहा है, कोई हाई रिस्क बंदा नहीं ले रहा है. इन सारी चीज़ों को देख करके एचआरटी की रिसर्च, स्पेशली जब हमारी लॉन्जेविटी बढ़ रही है, जब आज की तारीख में हम 80 साल से ऊपर ज़िंदा रह रहे हैं, हमारी बोन हेल्थ के लिए, हमारी कार्डियक हेल्थ के लिए, इन सारी चीज़ों के लिए जो भी मैंने लेटेस्ट जितनी स्टडीज़ पढ़ी हैं, उन सब स्टडीज़ में यही है कि अगर वो टाइमली लिया जाता है, देयर इज़ वेरी definite but small increase in the chances of CA breast and CA endometrium. It is not as much as you have the risk of dying from serious and CNS stroke or fractures.
Okay, okay, okay. Got it, got it. So, Dr. Pradhan, like there are, as we all know that there's cervical cancer, which is one of the leading cancer. Then there's the breast cancer, which is also common amongst women. So, and now since there's a HPV vaccination, which has just come up for the cervical cancer, can you just let us know about it, like how it is done, क्या उसके symptoms, how can we detect them early, because हम तो तभी पता चलता है जब हमारा everything is gone, then it's we have no nothing, we have nothing left. So how can we detect these cancers early?
So I'll tell you about each of these cancers one by one, how we can detect them early. And see, I mean, you didn't ask, but I'll tell you there are many myths around these cancers. First, I'll tell you about the breast cancer. Breast cancer, people come late. They don't come late because they're afraid of cancer, afraid of losing breast. It's very common. Or everyone who comes to me, I tell them you have got breast cancer. They start crying and they ask me one question, Doctor, I'm going to lose my breast. My answer is no. Breast cancer doesn't mean you will lose your breast. We have come to a modern era. We have got such nice treatment, radiation, chemotherapy, targeted therapy, immunotherapy, hell lot of things we have got for curing cancer. No one is going to lose breast for breast cancer. Someone gets a oral cancer, doesn't lose his head. We don't chop off the head. So similarly, breast cancer, people have got a myth that we are going to lose breast, we are going to die. It's a, I'll tell you, in a breast cancer, even if it is stage 4, we can completely cure it. There's a term called oligometastatic, where we have got 3 metastases, we can still cure it. Now, regarding early detection of breast cancer, see, for early detection of breast cancer, we recommend all women after 25 or 30 years start self breast examination. Self breast examination may not help. I mean, it may not detect a very small lump, but something. I mean, in young women, if there is a big lump, she comes to us. We may, investigate it. We may detect it at an early stage, and we can cure it. After 40 years, we recommend mammography annually to all women. And then there are some studies, they say after 75 you can stop doing mammography. I recommend no, do it till you are in good health, because till you are in good health, you are coming early, you're getting the cancer detected early, we can cure you. Your life will be long and you can have a healthy life. Someone getting a breast cancer gets a bony metastasis, she gets weak, she gets a fracture, how she is going to live? I mean, her life is deplorable. Even for 1 or 2 years that she survives, she's going to be crippled for that. So for early detection, screening by self-breast examination, which should start at 25 years, mammography, which should start at 40 years, 45 years, and then continue till she's in good health. Coming to cervical cancer, again, we have for early detection screening. Screening is by pap smear and HPV. HPV is actually a virus. I'll tell you in detail how this virus causes this cancer. But HPV is a virus, and detecting this virus in the cervix of a lady can help us detect that she is at risk to get this cancer. So pap smear is just a simple OPD procedure. Actually, ma'am is gynecologist. She knows better than me about pap smear because we are involved in all kinds of cancer. But we usually don't do pap smear. We can do, but gynecologists themselves do it. And pap smear, if you see any in situ carcinoma, any pre-malignant lesion, we just advise. I mean, if this lady is not in a childbearing age group, she don't require a uterus. We advise them hysterectomy because she has got a pre-malignant lesion. One day this may convert to cancer, and frankly telling you, cervical cancer is a killer. Once it goes out of the uterus, it just kills the patient. I mean, surgery cannot help. Radiation can, I mean, treat it, but once it is out of uterus, it will compress on the ureters, which are the pipes carrying urine from the kidney. And if these are involved, patient has very bad prognosis. I mean, it is going to kill. One more thing, that there are certain high risk population. You know, breast cancer is said a disease of 50s. After 50s, when actually this lady, she has got no natural estrogen and she's taking estrogen from outside. Hormone replacement therapy is being blamed for breast cancer. So now she is prone to develop breast cancer. But there are some high risk population, like young women. They are getting breast cancer. They might be BRCA positive. BRCA is basically it's a tumor suppressor gene. It prevents from cancer, but if it is mutated, it predisposes to cancer. So these people, they usually have a family history. They might be having first degree, second degree family members having breast cancer or prostate cancer or colon cancer. So it's not just about breast cancer, ovarian cancer, colon cancer, and prostate cancer. Even if these cancers are present in the family, we suspect that this lady might be carrying a germline mutation of BRCA gene. That is, in her family, this gene is mutated and is not able to protect her against cancer. So she's predisposed to breast cancer in early age group. Now, what we should do, you know, mammography is not going to help in 20s because breast is very dense. Mammography is an X-ray. So in dense breast, X-rays don't work. In such people, we recommend MRI. MRI can be done in such people, you know, once or twice, once in a year or once in 2 years. But mammography is the best screening modality for such women. USG is another modality, but it's operator dependent. We don't rely on USG. So in high risk population who have a known BRCA or any other breast cancer related gene mutation, or those who have a very strong history, family history of breast cancer or any other cancer, we recommend MRI screening for them. Then there are
Okay.
other cancer, I mean, other female uh, gynecological malignancies like uterine cancer. Uterine cancer is again usually considered to be a cancer of old age. If someone is taking hormone replacement therapy, they are more predisposed to uterine cancer. But then there are other variants also. Young females can also get this. So for uterine cancer, we don't have many screening tools. One is transvaginal ultrasound. Transvaginal ultrasound is a very good tool if in a good hand. This can detect uterine cancer in early stages. Again, uterine cancer, if detected in late stages, is a killer. So better if detected in early stages.
Okay, okay. So we have one question from Rupinder Kaur. She wants to know that
Yes, ma'am.
there is a CA of endometriosis in family, like my mother had, which was just diagnosed last May, and full chemo radiation therapy. She has gone through that. And about HPV vaccine is necessary to be taken to female grandchildren. What about any side effects?
Okay. Ma'am, first I will answer about HPV vaccine because you asked me and I forget to tell you. See,
Yeah, yeah.
I'm happy that it's a first vaccine which is against a cancer, which prevents a cancer. We need to understand this vaccine because using it rampantly without understanding is useless. This vaccine is useless if the female has started sexual activity, because you know HPV infection, the HPV virus is present on the surface of the mucosa, the cervical mucosa, and once it infects the basal layer of the cells, then from the basal layer it is going to go into the upper layer and it is going to form cancer. Once this basal layer infection has occurred, this vaccine is not going to help. because it's already infected, and now it's going to the upper layers where the blood is not going to reach. The vaccine is going, any vaccine, how it protects us, we have got antibodies, we have got T cells who are going to fight against this virus, but the blood is not reaching into the dead layers or the superficial layers of the mucosa. So once this infection is already established, the vaccine is useless. The best thing that protects against the cervical cancer is hygiene. Ma'am will agree with me. She also might be,
You are
counseling people
absolutely
for hygiene.
right. Absolutely
So,
right. And this
ma'am, we saw a trend that the cervical cancer suddenly dipped even without the vaccines were introduced in India. So this was because of running water in home. We got bathrooms, we got privacy at home. People can clean their genitals properly, and that's why the incidence of cervical cancer started decreasing. Today, the breast cancer has surpassed the cervical cancer. So this HPV vaccine is okay. It's a good vaccine. I agree. Side effects till now, there are no major side effects due to this, but this should be given only to the girl who has not started the sexual activity. And secondly, don't run after the vaccine. The important thing is hygiene. Go behind the hygiene. Hygiene is more important. Second thing, about coming to the case, she said that she has got CA endometriosis. It would be CA endometrium, I presume. And she has taken chemotherapy as well as radiation. I hope surgery has been done, because CA endometrium is firstly treated with surgery. Surgical staging is done. Then, depending on the stage which comes after the pathology report, we give chemo and radiation. Ma'am, can you help me with the question? What was the question after chemo radiation? What happened?
Yeah, she wants to know HPV,
Yeah.
is HPV vaccine is necessary to be taken to female grandchildren? What about any side effects?
Yeah, so as I told, there are no major side effects till now. HPV vaccine can be given to the kids, who are below 50 or who are unmarried, not had started the sexual activity. Yes, it can be given. Frankly speaking, hygiene is more important. Tell them hygiene is more important, but give them, no problem. And I was asking ma'am this question about the C endometrium. What you want to know further about the C endometrium?
She hasn't mentioned any details about it.
Okay,
Rupinder,
so
if
if
you're
you
there
want to
on live,
know,
you can just mention what you want to ask actually. So she can. She just want to know if there is a CA of endometriosis in family, like my mother had, which was just diagnosed last May. This she has written.
ma'am, maybe she want to know that if there is any risk in her to get. See, frankly speaking, C endometrium do come into some of the syndromes, like in Lynch syndrome. Uh, then we have a P16 syndrome. In these syndromes, C endometrium is there. But just having one case in family does not predispose her to malignancies. Yes, I agree. Family history is one of the important history. I'll advise her to undergo screening. Once in a year or once in a 2 year, she can undergo transvaginal ultrasound. That will help for screening for C endometrium. Apart from this, see, suppose if since C endometrium is part of Lynch syndrome, there are other cancers which are predisposed. So colonic cancer is a risk factor. She should see that in her family no one is suffering from colonic cancer. If they are, then they should get themselves tested for Lynch syndrome, which is done by a enzyme mismatch repair enzymes. Sorry, these are mismatch repair genes. By testing for them, they can just rule out Lynch syndrome. But if there is just one case of C endometrium, I don't recommend it.
Okay, okay. So, doctor, is these like if somebody is in like in a home, if somebody is suffering from breast cancer or any kind of cancer, is there any something genetic in the family or like it's not like that? How can you do the
Uh,
genetic testing whether some like the offsprings
Genetic
or maybe next generation will have it or not?
someone who is having just one member of the family is having cancer, we need not do a genetic testing. For all the cancer genetic syndromes, we have got some criteria that these many number of people, these many number in this pattern, in this age group, they should be. Like for breast cancer, they say for BRCA, if it is less than 40 years, people are getting diagnosed. If both the breasts are involved, or same lady, she's having breast as well as ovarian cancer, or her first degree family members are having breast cancer, then she is at risk for BRCA. She might be having BRCA positive, BRCA positive. So not everyone need to be tested. And
Okay.
getting this tested is very easily. Frankly telling you, in 10,000, a blood test is done and they will tell you about, these mutations in your germline. But it's not mandatory. Unnecessarily, you get some mutation which may not be pathogenic. Then you are just worrying that I have got a mutation. I may get
Yeah.
cancer. It may not be pathogenic. It may be just, just a mutation by chance we detected. So before getting yourself anyone getting tested for germline mutations, first meet a genetic counselor. See if you are at risk. If you are at risk, then only get yourself tested. And whenever you get a report, don't interpret with yourself. Go and meet your
Mhm.
genetic counselor or your specialist. They will tell you it is pathogenic or not. There are many mutations which are not pathogenic. They have no meaning. They are just passenger mutation. They are present in your body, not harming you.
Mhm. Okay, okay. So we have somebody who's just joined. I'll just take that person to on the
Yeah.
stage.
एक मिनट.
Preeti, hello.
Hello. Hi.
Yeah, just a moment.
Yeah, ma'am.
Yeah,
Yeah,
Preeti.
I
Yeah, hi, Preeti.
yeah, hi. Mm. Like Dr. Seema was just saying about the age of the female when the cycle is disrupted at the age of 35. I mean, everything should be done early. So
No,
I
no,
just want
no.
to ask, is it the same in the males also? Do they also have their cycle disrupted? Because the sperm count would always decrease at that age also, at 35 or 36. Is that so?
So,
Or
very
only the
good
females?
question, Preeti ji. And cycle disruption, not exactly I was talking about. I was talking about reproductive potential.
Yeah.
You were telling the same thing. The females, they start losing their reproductive potential. They lose it from the day they are born. In fact, inside when they are inside the womb, in fact. But वो 32 33 years तक 80% lose हो जाता है. If you are talking about the males, the same age reaches around 45 years, but
Okay.
35 years is the age which is taken as advanced paternal age as well. I've got a live video I did last week only, a talk show on this advanced paternal age doesn't matter. So 35 years is that cutoff for males too. And
Okay. Understood.
earlier count, before count motility, their morphology, and gradually count starts getting affected by the age of 50. The quantity of that liquid semen,
Yeah.
that also decreases. Yeah.
Okay. Thank you so
But
much.
it is reasonably fine till 45. But yeah,
Okay.
age related, all the changes that can produce lot of subfertility and traits in the future offspring like autism, and these are the things we
Okay.
have to think about. Yeah.
Thank you so much for shedding so much light on this. Thank you. What should I do?
I think Aparna ji got disconnected or something.
Yeah, ma'am, maybe. Ma'am, you were saying something about HPV vaccine.
Yeah, yeah, I was telling the same thing, that it is only and only useful for our teenagers, sexually inactive girls, even boys in schools like boarding schools. They are demanding, even US colleges, they are demanding HPV vaccination certificate. So, as you were telling, that virus is on the mucosal surface. So, only and only people who get benefited are who are sexually inactive, because this question comes every day. All these companies, they are propagating so much that everyone is coming and asking, madam, आज लगवा लें हम भी, हमको भी कैंसर से बच जाएंगे, एचपीवी का, and all those things. So this message is very important, that it protects only if you are sexually inactive.
Actually, yesterday a lady came to me and asked me that HPV causes so many cancers. Is this vaccine going to protect against these cancers like oral cancer, anal cancer, penile cancer, vaginal cancer? What to say? Yes, actually, since it
Thanks
is a
to
HPV vaccine,
Google.
it should. But there's no study to prove it. And
Yeah.
our medical science goes with studies. I mean, till we have a study, until we don't have a study, we cannot propagate it that yes, it is going to.
Until unless
Logically, it
there
should,
is
but we don't have
evidence.
any study. No evidence
Yeah.
for oropharyngeal or oral cancer.
But very smart and intelligent question.
Yeah, actually, I mean, she was doing a lot of Google research, and she
Yeah,
she
thanks to Miss
presented with some
Google.
benign
Yeah.
condition which she correlated with malignancy. I don't know, she might be one of the listeners, but she has done a lot of research, and her each question was very intelligent.
And so aware, and they are taking things into stride. They are only thing they should be their lifestyle factor 24 into 7 style of lifestyle they have to take care. लेकिन वही age के साथ ही सब
I'm so sorry. You know, there are few things which are out of your control, especially the network. You just can't do anything. Why? It just shut off on its own. Yeah, so sorry about that.
so Anamika, Aparna ji, can we just I'm not
Yeah, there
feeling
is one more question. There's one more question. Rupinder, her niece is 16 and 18 years old. Is it safe to administer? Can you just write the complete question? It's not in
I think he
complete.
is asking about HPV vaccine.
Yeah.
I know. I think उसी के लिए पूछ रहे हैं. Yeah.
Yes, it is
She
safe. They
can.
can go ahead. They can go ahead.
Yeah. So you got your answer. All right. Then thank you so much, both of you. Uh,
Thank you, ma'am.
Thank you, Aparna ji, for this opportunity. Have a great evening. Bye.
Thank you, ma'am. Bye.